disaster times really ramp up to responding to a disaster. So creating things like continuity of operations plans or COOPs, making sure that they have a succession plan in case someone in their staff is incapacitated or unable to continue serving in their role during a disaster, and other pieces that we all have really had to utilize, maybe a little more on the fly than we'd want to during this most recent and current disaster. We also have a nonprofit disaster preparedness work group. I think I saw maybe 1 or 2 members of the work group on the participant list, which is made up of our members and helps HSC remain really in tune with the sector and providers to make sure that the services we offer are those that you feel are the most important to our service or to our current disaster and to preparedness for your organizations. And I'll just also shout out that during COVID, we've been providing a number of services to our members and to all the human services organizations in New York, including Wednesday morning provider calls, an FAQ that we host on our website to get really niche information to everyone, and a resource list, as well as executive director roundtables where leaders of human services organizations can come and talk to the unique challenges presented by this pandemic. So we will share all of this with you all after the training. But for now, I think we can get started. And I will just say that this training and our current COVID response work is supported by the New York City Department of Health and Mental Hygiene and the Fund for Public Health in New York City. So we're very grateful to them for making this possible today. So we'll start a little bit broad, and I just want to kind of say off the bat that we're talking about disaster preparedness. We're in the middle of COVID-19, and the organizations on this call and on all throughout New York City and New York have really had to be disaster preparedness experts. You all are the COVID-19 experts just by nature of the fact that you all had to make sure communities are being kept safe and have the resources that they rely on to continue living healthy and resilient lives as much as possible. So we really, one, want to say just how incredible and how admirable that work is, and two, recognize that there's going to be a lot of expertise in this room that we hope we can share and make sure we share with the Department of Health as much as possible so that can help their work be most informed as possible as well. Of course, we all know that disaster preparedness is something that we can do as much as possible prior to a disaster preparedness, because during a time of disaster, as we've seen during COVID, there's just so much that happens so quickly, and the more you can do ahead of time to make sure your organization can maintain continuity and remain resilient is certainly as the more you can do, the better. It's always easy, of course, to address issues beforehand and to really ensure that you have everything to be as automatic as possible when a disaster hits. And I want to, kind of frame this training as well by saying that, the purpose of today is not to prepare you to respond to COVID-19, since we're already in the middle of that. You've been doing it. But what we're hoping to do is really share this pandemic planning toolkit, which is developed by the city, and find ways to fill gaps in your preparedness for a continued response or the next response or the vaccine distribution. And help really give feedback to the city so that they can be, again, more helpful to you all and to the sector in general when we move forward into a third wave of response or to recovery or to, again, the vaccine distribution. During the first wave, we were all really responding with just gum and glue to kind of make things work because things happened so quickly. And so it was also unprecedented. So that is simply, for so many of us, not something we can continue doing as we move into third wave. So it's about filling in those gaps now. We're just going to start very quickly by doing a pretest poll to get a sense of where folks are coming from. It's going to be a varied response of how much preparedness you've done before. So Jason is going to share a few poll questions, and we'll just give you 2 minutes to fill this out, and it will help us kind of keep track of where we're going throughout the presentation. And you do have to scroll down. There's a couple, I think there's 4 questions. Yeah, 4 questions to fill out. Great. So we'll do like 20 more seconds. Looks like most of you voted, but for the last folks, just get those responses in. All right, great. I'm seeing, just as people are still finalizing their responses, about almost exactly half have taken a disaster preparedness training before and half have not. So welcome to those who are new. And I'm seeing a lot of almost exactly half again of folks who have COOPs, continuity of operation plans, and those who don't. So again, we'll be sure to share a lot of resources for those of you who are either looking to update your COOPs or need to start one from scratch. And I'm impressed that 27% of folks said they were very prepared for COVID-19. Good for you. That is that was a challenge for a lot of organizations, including HSC, and I'm really glad to hear folks felt prepared. So, all right, I think we can wrap up the poll. Great. So what we're going to be talking about in large part today is this pandemic planning toolkit, which is created by the New York City Department of Health again. Jason is going to put the link to find that on our website in the chat. And it's quite long, so we're going to break it down today, but I encourage you to go back and find the things that will be useful to you. My cat is definitely going to get involved in this training. I see him, here he is, so forgive me for that. He likes to be on Zoom. But what I want to say about the pandemic planning toolkit, and we'll talk about throughout, is this is really a 1.0 version. We know there are things the department is looking to improve on. There are things we've already shared with the department that we think would be important to improve. And it's going to be important that throughout the training, if there are things you think of, put them in the chat. If there are things as we do the prompts throughout this, please put them in the chat. We would love to get information to the department to make sure that their 2.0 version is even more helpful to you all and has the tools that you need, whether that be like translations of the toolkit, more worksheets, anything like that. Please be thinking about it and email us after. We'll remind you of this a couple times. And the other thing to keep in mind about this is there's a lot in this toolkit, and everyone will not have all the time and resources it takes to really do everything that it asks of you. And that's okay. We all know the human services sector, as HSC is always advocating for, could use more funding. And it's important that you just make sure you prioritize what is going to be key for your organization and what perhaps you could do with less funding or to a certain extent or save for later. So that's something you as an organization will have to bring back and really discuss. So, okay. So the 3 C's of pandemic planning that we just will start off with, since they're going to come up in different ways throughout this presentation, are community, communication, and continuity. And, in order to prepare for a pandemic, you want to make sure that you really think about, we'll start with community, the different people that your organization affects. We'll go into this a little bit more about defining those and naming those people. But ahead of a pandemic or in any kind of disaster, you want to make sure that you know exactly who is going to be the people you need to communicate with, so you're not trying to tabulate that list after you're already in the middle of a response. Communication fits right into that as well. How are you going to reach your community? Because whether it be a pandemic where folks are just really dispersed in a way that they weren't before, I know that's obviously the case for a lot of organizations that are doing services in person and no longer were able to once COVID came to New York. But also, if we broaden this to larger disaster work, in a coastal storm with Sandy, we saw so many folks lost power, lost internet access. So thinking about how you could reach them if that was not possible. And then continuity is pretty straightforward. It's how are you going to make sure that your organization can continue offering your core services, your core mission services. Jason will talk a little bit more about this, but you'll have to work with your leadership and with your staff to figure out what are the services we cannot stop offering in times of disaster, because there are simply too many people who are relying on it, and it is also part of our key mission. So making sure you have everything you need to continue offering those services. So I will pass it over to Jason now to talk a little bit about some of the community decisions you'll have to make as an organization.
Thank you, Jen. So the first thing that we want to talk about is, of course, our internal community. So the internal community is really comprised of those individuals that are under the organization's direct authority, such as people in your leadership or management, your general staff, your organization's volunteers. It's important to note that your internal community can be very large and is not actually limited to just those people that are inside a particular building or service site. So for example, if we think about HSC's own internal community, we would count amongst them our board, our staff, and our one student intern. We're a pretty small organization. So some of the questions that you might want to ask yourself with regards to whether somebody belongs in your internal community or not is whether they provide an essential function at one or more of your facilities, whether they provide an essential function by going directly out into the community that you're serving, if they make leadership decisions for your staff or volunteers, if they direct staff in their day-to-day activities, or if they just work directly with the other staff within your organization to accomplish organizational tasks. So you might have noticed that I said essential functions just now. It's very important for an organization to really define what the organization's essential functions are. These are the mission essential functions that are necessary for your organization to fulfill your mission. It's really what you do to be you. So the primary business functions, on the other hand, are the business operations that are critical to the organization to allow it to do its mission essential functions. And so just as an example, making payroll is a primary business function because it's critical to the operation of the organization itself, but it's not necessarily a mission essential function because it's not integral to the mission. And so as you get started, or as you review your plan, it's really helpful to think through what the organization's essential functions are, because in the midst of an emergency or pandemic, as we're seeing now, it might not be possible to continue doing every single program that your organization is currently doing. And so if it's not possible to continue doing every single program that your organization is doing, perhaps because of a lack of resources, for example, it's helpful to determine what your organization's core function is and to think through how you can continue performing that specific core function. So just to give you a little bit more detail on the 3 different types of internal communities, when we're thinking about the leadership and management in planning, it's really helpful to try and establish a structure for your leadership to continue during a major emergency using things like delegations of authorities, or orders of succession planning, so that your leadership can help you be prepared, to continue to function if some or all of them are not available. For staff, the same thing applies. It's helpful to think through what are some critical staff functions that individuals are responsible for and to identify backups for them. And many of our organizations use and rely on volunteers to perform a lot of different tasks for our organization. And so it's really helpful to also think through whether these volunteers are performing any mission or business essential functions that you also need to identify backups for in the event that they are unavailable to continue helping out during the emergency, because it would be pretty difficult to get things back up and running if a volunteer is responsible for your IT or your website and all of a sudden they're not able to continue helping you during the emergency or pandemic in this case. So these are just a couple of things to consider after you've identified who the individuals within your internal community are. Do you have contact information for all the key people involved in your organization? And if you do have their contact information, how many different points of contact do you actually have for them? So for example, do you have their home phone number, their cell phone number, their work email address, their home email address, or any other ways of reaching out to them in the event that one or more points of contact aren't available? And then of course, it's also important to have current contact information. So when was the last time you checked that information? Just to see if it's still current. People can change their cell phone numbers. They might not be at that organization anymore. They might have changed their email address. It's always helpful to have these available before And then besides just collecting this information, it's also useful to make sure that you have backups of this information and that it's easily accessible in a couple of different ways. So depending on the emergency, and I understand we're talking really about a pandemic today, but depending on the emergency, if this contact information lives with just one specific person and they're unavailable, then you don't really have access to that contact information. If it's only available online through a database, but the internet is down or there's no power, then the person that might need access to that contact information might not be able to get to it. And so it's helpful to have things, on paper, on a database, and available in just a couple of different ways, so that you're never really cut off from important and critical contact information for specific people within the organization. Of course, the other two things that I mentioned a little bit earlier is to think through a little bit about, for the staff that you have contact information for, is there somebody who can take over their various responsibilities or duties if that person is unavailable? And do we have the ability to assign somebody to take over those emergencies in the event that that person is not available? And we'll talk a little bit more about that as we get into continuity. And so, of course, after you've identified who the people in your, in the organization, in your internal community are, and you've gotten their contact information, the next step is, of course, to think through a little bit about what you actually want to communicate with them. We found that during this pandemic, communications, and in all emergencies, actually, communications are very critical to make sure that people have the most up-to-date information that they need to be able to continue doing their jobs. And so it's helpful to think through what are the different types of communications that are most appropriate for the three different groups that make up your internal community. So what kind of information do your volunteers need to know versus what kind of information do your staff need to know, and what kind of information does your leadership and management need to know? And that can differ. I mean, there are certainly some pieces of information that all groups will need, things like general hygiene information, or maybe whether a location is open or closed. But there's other information that, for example, your volunteers may not need to know, that only your staff need to know, or that only your leadership and management need to know. And so there are three different time periods that are important to communicate with these individuals: prior to an emergency or a pandemic, during, and then, of course, after. And there are different pieces of information that needs to get communicated during each of these time periods. Of course, we are all living through an emergency right now. We have been for the past 9 months, and we've apparently just hit a second wave. And so, please note that some of this is not as applicable for right now, but will hopefully help you in planning for future emergencies or even a future third wave if we see that happen. So on the screen, you have just a couple of different types of information that you might need to distribute to those various groups that I just mentioned. So things like continuity of operations information. So, who covers which positions if a person is unavailable. A delegation of authority, which is, who's most qualified in an emergency if key leadership staff are unavailable. Any human resources policies that you might have developed around sick leave or working from home, or things that might have come out from the state or the city or even the federal government. Now, we're seeing the beginning of vaccinations. So any information around vaccinations as it becomes available. If there are particular trainings that your staff might want to or might need to attend, and just, again, general hygiene information that's, helpful in helping to curb the spread of COVID-19 or any pandemic disease. So, before I mention the three different time periods, so just to kind of break down a little bit into what kind of information might be helpful when. Prior to the pandemic, if you know that there is going to be one, or if you know that there is going to be an emergency that's coming, if that's something that's been in the news, or we know that it's going to impact our organization soon. Things like any additional work expectations that might come about as a result of this emergency, orders of succession, again, delegation of authority, any information around overtime, sick leave, family leave, any policies around working from home or telecommuting, any emergency procedures that your service site or your organization might have, and information about alternate partners or vendors in the event that people that you normally work with become unavailable. There is, of course, now, as we're seeing, information about vaccines and vaccinations that you might want to start providing if it is available. And also requests for input from your community, asking people what they need so that you can also better help them continue to be able to provide the services that you're providing. During a pandemic, your communications can include, anything that I just mentioned, as long as they're still relevant, but also things such as, if any staff are out and who is replacing them. If there are any emergency or alternate contact information for specific staff that need to get shared with specific people, or whether the organization is serving additional services or alternate services, or whether there are any additional or alternate services available for your staff. And then, of course, continued information about, say, test and trace locations, if that is something that might be useful for your staff, or again, information about vaccines as it becomes available. And then after the pandemic or an emergency is over, conducting an after action review, which is a process where an organization engages in, after the emergency or disaster is over, bringing together management, staff, other partners, volunteers, and anybody else that was involved in the response efforts to discuss and review what actually happened. What worked, what didn't work. It's important to communicate with them because you can use that feedback to create an improvement plan to make sure that your continuity of operations plan is updated, and so that the next time there's an emergency, or hopefully never again, but the next time there is a pandemic, that your organization can be better prepared to respond. And so now that you figure out the types of information you want to distribute, it's helpful to, of course, think about how you want to distribute the information. Different people receive information in different ways, and of course, different types of information get shared more effectively in different ways. And so some of these examples are, using social media, emailing people, using a robocall functions to call all your staff and let them know of any updates, sharing memos, having one-on-one conversations, or hosting presentations for your staff. If you're in a physical location, putting up any posters or signs, making sure that your external website is updated so that people in your community can see what's going on. And then if you have an intranet or like an employee website that's only visible to your staff internally, updating the intranet. And so here we have a small prompt for you, kind of asking, what are some of the strategies that you've been using to communicate with your internal community? What's worked and what challenges have arisen? So please feel free to just type that into the chat to kind of let us know how you've been communicating internally with your staff and whether that's been working or not. And again, it's helpful to think about communicating with them in different ways for different things. So like, for example, you might use robocalls if your service site is closed for the day for any reason, right? But you might use an email to share that a staff person is out and who that person's replacement is. You might hold a presentation or have direct one-on-one conversations if there is a new policy that needs to get announced widely and you want to make sure that people have the space to respond to any questions that they might have, to ask any questions, and so on and so forth. So as you're kind of typing into chat, I'm gonna move it over to Jen, who can start talking a little bit more about the external community.
Great. And just as I get started, I'm seeing some good things show up in the chat, including making sure that there's regular manager meetings and trainings to get your leadership involved in all the up-to-date information. In-house posters and signs. That's great for organizations that have service sites that are maybe spread throughout the city. It looks like Microsoft Teams has been a little bit challenging. I know that's a new program for me. Text messages, emails, phone text, weekly meetings. So this is great. I hope you all get a chance to review, since I think, as we've discovered with our executive director roundtables, we're all the best people to be talking to each other about COVID, more so than anyone who's from outside the sector. So please keep sharing your expertise. A formed committee to assess and consider the needs of staff. That's great. So we're going to talk now about sort of the opposite of the internal community or external community, which is often a sort of a larger group that you communicate with. And what we really define the external community is the groups that you don't have direct authority over to, ask them to make certain decisions or to operate in certain ways. And there are two different buckets that this external community falls into. The first are all the folks like your vendors, contractors, partners, and agencies and groups who you really need to work with in collaboration for your organization to be successful in a disaster. And then the second group is your clients or the people that you serve directly, and the people who rely on your services for whatever particular piece that they're offering to enrich their lives. So just to start with clients, since that's kind of the most distinct group for many of the organizations we work with, it's really important to take into account as you are preparing for disaster. So we suggest literally writing this down and making sure it's defined and named amongst your staff. Not just everyone who comes to your organization walks through the door to get a meal or to get a counseling service or something like that, but to really broaden your mind to think about all the people your services affect. So that could be the family members of your clients. It could be the children of your clients, who are their families. It could be the neighbors who live around the building that you are offering these services in, but really thinking about, like, if we were to shut down or if we were to change our services, who would potentially have some sort of affect to their lives. And then write all those people down. And then when we start talking about the partner agencies, that's the second group at the bottom, partner agencies and groups. These are often the people who are in this training with us right now. There are other community groups, faith-based groups, large and small service organizations that may support your mission during blue skies or during disasters with services or supplies. They might provide services that are really complementary to what you offer or have a mission that is aligned with yours. This group can also include your local, state, or federal government agencies that you work with during disasters or blue skies. And it also can include partner agencies that are private businesses or academic institutions, other types of organizations that just you work with directly in times of disaster or blue skies. And it's really important that you have a stock of all those organizations that you need to reach out to if there's a disaster. I think a great example would be if there was a hurricane that made it so you were no longer able to offer services in a particular site because it got flooded. Who is the organization you're going to start sending your clients to make sure they still get the hot meal that they rely on every day? So really knowing exactly who you need to reach out to, not only because you necessarily are in like full crisis mode, but who you need to start talking to the second the hurricane hits, the city shuts down, whatever it is, to make sure that you are aware of who is serving what function and how you can collaborate. Because again, as Jason mentioned, your essential function may not include all your programs. So how do you make sure that everyone your organization relies on has the things that they need? And then the final group is your vendors and your contractors or the suppliers who provide anything that your organization needs to continue offering your essential functions. So it could be everything from, the people who provide the ingredients for the food you prepare, medicine, buses or transportation, printing, tech support, whatever. But we consider the people in these groups, the organizations that provide something that is necessary to the continued functioning of your organization and the quality of life of your community. And it may not be possible to ensure the vendors you rely on will continue to function, of course, in the times of disaster, but you can ensure that your organization continues to function because you'll talk with your current vendors about what their plans are to serve a community during a disaster. And you can also just make sure you know how to support vendors if there are people that you need to make sure continue operating. So if that's at all possible. And then the other big piece is to make sure you know who you will get supplies from if the one you always work with during blue skies has trouble or is no longer functioning. So if the person who's no longer offering the ingredients to you has a flood in their basement, who are you going to turn to next? So again, this is all about writing down a list of everyone who you need to contact in times of disaster, but also be in communication with in blue skies, so you know exactly who it's automatic of who you need to reach out to when sort of the crisis occurs. Okay. So in addition to the elements we discussed in internal communication, there are obviously more factors that you have to really consider when you're talking about your external communications, because external communities, as I just discussed, can be a lot broader than just your internal communities. And of course, you don't always have the direct line of communication built into your processes because you're not on a staff chat or a Microsoft Teams or whatever it may be. So also, of course, people in your external community may have a really diverse set of needs that can also be in your internal community, but just by nature of how large an external community can be, that's more likely to occur. And so it's important to remember, as we all saw during COVID, during pandemics, during disasters, communities turn to CBOs for guidance, for resources, for information. We are often the first places people turn for a trusted source of information. And without direct authority, your external communications are essentially recommendations. So it's really important to make sure that your communications are accessible, easily digestible, and compelling, because people are going to be getting information from all over the place. Information overload was certainly a challenge during COVID. And so how are you going to make sure that what you have to say breaks through all that noise? And of course, because again, an external community is very large, sometimes hard to know exactly who is in it, I think it's always smart to make sure your communications really are accessible to people with functional or access needs. So people who may be hard of hearing, who may be blind, who need translation services, who need large print versions of everything, making sure you have all of those capabilities set to go in times of a disaster. So, making sure you have everything that you need to get the translation done, or to, have a person that you can call to help you review a translation is important. And then, of course, like communications, often when we talk internally, it can be very in-depth, very jargony sometimes. A 20-page memo may be appropriate for your leadership staff or your program staff, but that would not be appropriate for a large external community, because again, people will have different abilities to digest information, and also simply will not have the time or the interest maybe in reading a 20-page memo. So it's important that you really are able to relay your message effectively by making sure that your information is really distilled down to the key pieces. We saw in COVID, for example, there was a lot of great flyers organizations put out, little palm cards, social media graphics, all sorts of things like that people put in about hygiene, because it wouldn't make sense to put out a huge scientific booklet about why washing your hands and social distancing was important, but people still needed that information in a really quick and digestible way. So your priority audience, again, may not be able to use all the services that you really want to use in your internal community, so like social media, but people who interact with them may. So it is also useful, I think, for organizations that may serve folks experiencing homelessness. While we may not assume that everyone will have access to social media in that client base, that there might be a way that people are still getting information via a friend or a family member or community member through that channel. So being creative about thinking how you're going to get information out and making sure you cast a really wide net, because again, your external community is simply so large. So there's sort of 4 tenets of what external communications need to consider to make sure that they are accessible and that they have all the pieces of the puzzle that make effective communications. The first one, of course, is trust, which is just making sure that your organization is consistent in your messaging, offering information that can be backed up with, whether it be science or support from other agencies that have trust from the community. And when you're looking for trusted people, it's important to broaden your scope to not just for looking at information that comes from a government agency, but also to where are people getting information? Is it from an online source? Is it from family members? And really using the places people trust as a messenger for that information as well. People have been using social media for COVID information. If that's where you need to put it, that's where you need to put it. And making sure we all work together as a sector to make sure our information is consistent and clear, so you're only ever putting out information we know to be true. And I also always think it's important to say that trust cannot be built in times of disaster. It has to be built consistently and slowly over time in blue skies, so that you can always have it already in place once a disaster hits. Culture is the next factor. There's, of course, a large variety of cultural factors you should take into consideration that can really affect how communications are received. So in different neighborhoods and different communities, folks may be listening to different sources of information, and organizational personnel may have easier access to communities than emergency responders. So people who are already within communities, whether that be through CBOs or whether it be through faith-based institutions that are in the community, and really facilitating community adherence. It's important to use multiple spokespeople because, again, you're going to have different people receiving different information each way. So consider the expertise, of course, of multicultural specialists and how they can bring help, support to your team, and make sure it's a two-way street when you're inviting community members or people from the faith-based groups into your communication strategies. It's about making sure that they're participants and that you're listening to them and what they're telling you about the community, so you can tweak all your information to make sure it's as effective and as widespread as possible. So collaboration, I think, is probably the key word here to help make cultural messages effective, or messages effective across cultures. Comprehension, we talked a little bit about, but people, of course, are going to have different levels of understanding, different backgrounds, different language access. And so making sure your messaging is clear and concise, compelling, and offers really simple and easy to use instructions so everyone can really access and use the information you offer. And then controlling rumors is the last one. And I know so many of us have had to deal with this during COVID-19. It's a huge issue that everyone faces during any kind of disaster. And just really what we can offer are these tips for consideration when you're kind of trying to dispel rumors and avoid potential misinformation. The biggest one, of course, is just making sure everything we communicate is true and that it's not ever, rushed in order to get something out because we think it's true. We don't need to use unnecessarily dramatic language to make sure that things are more alarming, because that's only going to cause panic and fear. But while still being honest and realistic, we want to make sure we avoid that as much as possible. And of course, we want to continuously listen to information coming out of the community, so people who are hearing rumors can share those with you and make sure that you're able to address those head on rather than avoiding addressing them, because that's certainly a way to help dispel rumors, is if you actually talk about what people are hearing and believing. Communicate quickly and often, but be sure to verify your messaging before sending it. Make sure to say what you know and what you do not know. I think so often we try to just encompass all things and make it sound like we know everything, and it's okay to say that's not true. Be specific and consistent in your guidance. And I think that's really across the sector, again, working with partner agencies to make sure that that is happening in all the places people are getting information in the community. And consider, lastly, whether the information you're sharing will stigmatize a specific person or group of people, and make sure never to share information in a way that makes it seem like a specific person or group is responsible for the disaster. And I think that's, of course, something that's important in every facet of our communication, but especially in controlling rumors. So I'll just let you kind of browse this list a little bit. These are just some of the types of communications that you might share with your community. I think a lot of them will be important in the coming weeks and months, and also a lot of these things are what we've already been sharing. So, of course, vaccinations, we hope to be sharing a lot of information about that soon. General preparedness, where people can get services and information, where they can get partner information or services that you may not provide. Government assistance, that has been really crucial during COVID and there's just so confusing. So that's a helpful thing you can provide. Special hours of operations, and so many of us have changed things during COVID, and just general hygiene information. And someone just put in the chat whether the presentation is being recorded. We will be sharing all the slides with you after, as well as a series of resources that complement. So hopefully you'll be able to share that with your staff. And then how can we distribute the information? So again, here's another list for you to go through at your leisure. We know that for external communities, it can be harder to reach folks, but using a broad range of strategies can be really helpful. So again, social media is such a crucial one to employ. Using your website, mass emails and mailings, flyers and handouts. Canvassing was really important during COVID, since people weren't necessarily leaving their houses, and especially older adults maybe weren't looking online in the places we were putting out information. Offering posters, signs and billboards, presentations, lectures or meetings, which can be challenging during a pandemic, but we've all adapted digitally. conference calls have been a great way for people to get tied into information. And then we'll take a brief break in a moment, but I want to finish up this section by talking about the barriers to communication, since this is such a key component of getting things out and about into communities. You know, there's a lot of different barriers folks may face when trying to get information they need about COVID or about any other pandemic. Cultural barriers, and I should say we should really make sure that we're thinking about how our communications sort of avoid all these barriers or break them down as much as possible, because that's our responsibility as the communicators rather than the person receiving them. Cultural barriers, I mean, that's whether, you know, there's certain colors, symbols, gestures, words that may have different meanings in different cultures. So making sure that you are really informed by your community about what people are perceiving in your messaging, what the tone is, and things like that, to avoid any kind of barrier that may prevent someone from receiving the information in the way that we're trying to communicate it. Language barriers is pretty straightforward. Does someone speak the language in which the communication is coming out in? You know, I'm sure a lot of you are used to translating things for the appropriate communities that you serve and work with, but again, it's easy on the fly to kind of forget that one. Structural barriers, this one of course is like whether your community faces different inequities due to race, ethnicity, immigration status, income level, or other characteristics. And so making sure that those inequities are openly discussed in your organization and in your community and addressed in planning, so they can really, you can really create communications that don't stigmatize folks and make information welcome and accessible to everyone. Sensory barriers are, again, pretty straightforward. Are folks visually or hearing impaired? Do they have other sensory disabilities which will just prevent them from receiving messaging? So how can you make sure that you have an audio version of your important messages, a large print version, something like that? And then access barriers, that's like pretty fundamental of, can people physically get the information you're providing? Like, is it in a place that people can't access physically? Is it online when people are not in your community, cannot use computers? And making sure, again, just diversifying your information so that you can avoid this. So if people can't get it one way, they may be able to get it another. And then comprehension barriers is whether the information you're sharing is just comprehensible to the people you're sharing it with. So again, making it clear and concise. We've talked about that a fair amount. And so I think a lot of the strategies to overcome all these barriers are working with partner organizations, listening to your community, and continuously being willing to tweak your communications to make them more effective. Asking government agencies, since they have a lot of broad city knowledge, and helping you inform your communications. And then finding volunteers who can help disseminate it, because while someone may not you know, be able to come into our doors to get the information, they might be able to hear it from their synagogue leader, their church leader, their neighbor, their you know, the person who runs the community garden near them, something like that. So making sure you have a lot of messengers who are within the community to support your messaging. So here we're going to pause. We're going to take just a brief 5-minute break since Zoom is exhausting, and we will be reconvening. Let's see, it's 10:20, so we'll come back at 10:25 to finish up the presentation. So stretch your legs, get a glass of water, and we'll see you back here in 5 minutes.
Hi, everybody. If you're still with us, just wanted to let you know that we'll get started again in just about 1 more minute. So grab that last drink of water, stretch your legs. We'll get started shortly.
All right, everyone. Thank you for joining us again, and I hope that was a restful and recharging break. I'm going to pass it over to Jason now as we continue to talk a little bit more about continuity and that final C of the pandemic Cs.
Thank you, Jen. So hopefully everybody is back with us. What we've just talked about is a lot of planning and preparation work. The next part of it is, of course, planning for continuity. So what does continuity mean? It's really having a plan for your organization to continue to function during an emergency like a pandemic. And as we've all seen, as the pandemic worsens and continues, there becomes fewer resources available for our organizations to be able to continue providing services. Potential impacts that a pandemic or emergency in general can have on our organization and the people that we serve are things like, staff shortages, transportation problems, shortages or gaps in our supply chain. These are some of the things that are important to kind of think through and to plan for in order to make sure that your organization can continue to function and can continue to serve your communities. Again, we've seen a lot of these impacts and we're continuing to see them. Staff that might be in isolation or in quarantine because they've been exposed. And so now that staff person isn't there to perform that specific job function. Things like, need to get access to hygienic cleaning supplies or PPE, which we've seen continue to be difficult to get at times. Things like interrupted supply or deliveries, which can be delayed or canceled because those areas or those vendors that you're depending on have become severely impacted by the pandemic. And then, of course, the pandemic itself can impact the communities that you serve more severely than other groups of individuals, which can put additional stresses on your resources. So for example, if your organization serves older adults who are more susceptible to contracting COVID-19, your organization might need to do more or have more things in place to try to ensure their safety as you're providing services. And the purpose of continuity planning is to really make sure that your organization can continue to function as completely as possible during an emergency. The biggest difference between this COVID-19 respiratory pandemic and many other emergencies is that this pandemic can be dispersed widely geographically and also can arrive in many waves, which we're seeing now that we are officially in a second wave that can last many months at a time. And so organizations are encouraged to review their existing continuity plans if you have one, to ensure that there are additional considerations in place to help address some of these potential issues. And of course, if you don't have a plan yet, it's never too late to start creating one, just to make sure that you have some of these policies and procedures in place in writing that's easily accessible for your staff. And so, there are 3 different components that typically organizations can go through while creating a continuity of operations plan. There's the planning phase, the training phase, and the exercising phase. So the first thing to really keep in mind is that when you're developing a plan, you should have planning meetings with as many members of your community as possible. So again, that's your leadership, your management, staff, volunteers, the external community like your vendors, your partner agencies, and perhaps even the community that you're serving. Sorry about that. I think the cat just moved us forward quite a bit. And so the reason why you want to have all these different community members in these planning meetings is because they're the ones that can provide the best input into your planning process. Leaving out representatives from any of these groups can potentially cause important factors from your resiliency planning to be overlooked. And so, the planning phase is really trying to meet with these community members before an emergency has actually happened. So I know Jen has been referring to blue skies. What that really means is, in more normal times, when there isn't an emergency or when there isn't a pandemic. Obviously, that we're in the middle of one right now, so it's a little bit too late for that. But it is also important to conduct meetings and these review meetings during a pandemic in the early stages and throughout to make sure that the actions that you are taking and have been taking are effective, and to agree on any changes that you might want to or need to make to your plan to make them even more effective going forward. And then hopefully, when the emergency or when the pandemic ends, to meet with these individuals afterwards to review what worked well and what didn't work so well, so that you can be even more prepared for the next emergency or the next incident. So, the planning process is, again, what happens before, an emergency, hopefully. So after you've created a plan, then there's the training component, which is actually putting the plan into action and testing it out and training your staff in the plan. The plan is only useful if the people involved that are going to be impacted by the plan actually know what's in them and that they're aware that one exists. So earlier when we did our pretest poll, we saw that many people were aware that their organization had a continuity of operations plan, but there were certainly others who weren't quite sure. And so it's important in that case to make sure that if you do have a plan available and in place, that everybody within your staff knows that it exists and knows what's in it. And then if at all possible, it's very helpful to actually exercise or put that plan into action through a tabletop simulation, for example, just to kind of run through the various parts of the plan itself so that everybody knows and understands what's in it and understands how the organization might shift or might adapt in the event of an emergency. You can practice having people sit in for other people in leadership or in other staff positions. And again, we'll talk a little bit more about what the orders of succession are and what that really means. Just to give a very quick example, HSC spent about a year when we were creating our own continuity of operations plan. We had a lot of conversations internally and externally with the people that we work with, just to make sure that we were identifying what our key functions are. We were identifying what we were going to do in the event of an emergency. And again, it wasn't specific to a pandemic. It was just what we would typically do in the event of any emergency. After we created this plan, we made sure we distributed it to the entire staff and asked everybody to take a look at it, to read it over. And then we held actually held a tabletop exercise for the plan itself. So we spent about 2 or 3 hours. We had the consultant that we were working with come in with a scenario, and he would just say, in week 1, this happens, in week 2, that happens. How does HSC shift? How does HSC adapt? What does HSC do to make sure that we can continue providing the services that we provide to the human services community? And ironically enough, when we did this plan about 1.5 years, 2 years ago, the scenario that our consultant came up with was actually a pandemic in the summer. And so we had to test out all the parts of our plan. We had to figure out, okay, what is HSC going to do in week 1? What does HSC do if our executive director is unavailable? What does HSC do if I'm unavailable or another staff person is unavailable? What do we do if, in XYZ? And so we talked through each of these different scenarios so that when COVID-19 actually happened, I think the staff felt a little bit more prepared. And of course, even before the official kind of lockdown or pause in March, we spent a couple of days making sure that we went through our plan again as a staff so that everybody knew what would happen if there was a lockdown. And so, not to speak for everybody else, but I certainly felt a little bit more comfortable and a little bit more prepared with all the changes that were happening as a result of this pandemic. So, again, what are the plans that you want to have in place in case some, most, or even all of your leadership, management, or staff aren't available? So earlier we talked a little bit about the orders of succession and these delegations of authority. So why is it important to have these plans in place? It really helps build resilience for the organization. Resilience just means how quickly you and your organization can recover from the challenges that are presented by an unexpected situation, such as the sudden onset of a pandemic. How well your organization can cope with these challenges and can continue to serve your clients is really directly related to how well you prepare yourself and your community. And so, being able to plan, train, and practice for some of these potential impacts is, really helpful for your organization to be able to continue to function. So when we talk about orders of succession, again, what this really means is who takes over when somebody is unavailable at your organization, somebody who is, performing a critical staff or is mission essential function. The delegation of authority, on the other hand, is really who has the power to put somebody in charge of something that they usually aren't in charge of. And so a couple of things, to think about when you're trying to figure out which functions are really critical to your organization's continued ability to function. Some of the things that you might want to think through are what are the things that your senior leadership are doing, the administration, human resources, finance, accounting, or payroll, information technology, IT, marketing, communications. Does your agency provide any medical or mental health care? Facilities, maintenance and support, public safety, delivery services, food service. These are just some examples of functions that your organization might be performing or might have. And so thinking through which of these are critical for my organization to be able to continue to function in an emergency. It's helpful to also think through which staff members are essential. Of course, we all know that the human services workforce are essential, but who are some of the individuals that are very mission critical that are able to keep your organization functioning? So these might be your direct line staff who are providing the services to your clients. These might be the people that are providing information to your staff, like human resources or payroll, and so on and so forth. And then, of course, what are some of the general supports that you might need for your staff to remain functional in the emergency? So, again, providing information around testing, providing information around vaccinations when it's available, providing information about policies around telecommuting or working from home, and other support that they might need to be able to actually work from home. Like what else do they actually need to be able to do this? After you've developed an order of succession or delegations of authority, it is also helpful, if at all possible, to cross-train your staff to make sure that they can actually take over some of these functions in the event that they need to. And so here we're going to go into actually a brief exercise in just a moment. So what you see here is something that's actually in the pandemic planning toolkit. It's just this template that I think is pretty helpful in helping you start to think through a little bit of what are some of the critical functions of the organization and who are some of the people that currently perform them and who are some of the backups. So, when you're creating this continuity of operations plan and when you're creating a resiliency plan for the organization, make sure to create a list of the critical functions of the organization. This can include, what the management does, general staff, or even what the volunteers do. It's important and helpful, if at all possible, to identify 3 different alternates, for important positions or functions, but you should identify as many individuals as you think you'll need. So when we talk about the function, again, what we mean is really the duty or the responsibility that that individual is carrying out. When you're creating this plan, it's important to note that the actual function itself is more important than the person's title. So when you're finding an alternate person, it's important to find somebody who can actually perform the function, not just somebody who has the same title. And so again, as an example for HSC, Jen over here is really responsible for all of HSC's communications. She's the one that puts together our e-blast. She's the one that updates our website. She's the one that gets that information out. In order for us to have a good resiliency plan, HSC then needs to find another person that can take over what Jen actually does, which is, again, sending out the information in our email communications and then also keeping our website updated. For HSC's case, I'm actually Jen's backup. So in the event that Jen isn't available, I'm the person that goes and sends out the emails and can update the website. And it's because I can actually do those tasks, even though my title doesn't have anything around communications in it, since I'm more focused on the operations aspect. But we have trained each other so that one of us can pick up for the other one if we're unavailable. In the template itself, when you're looking at the position, this is really just the name or the title of the person that can take over that function. This is really just used for helping to identify the person themselves. And then name is, of course, the person's name. Their contact information, which is how you can reach them. Again, it's always helpful to have multiple points of contact. And then the notes column is really any additional important information, such as where they work or who their supervisors are, etc. And so it is really helpful to, again, establish a structure for your leadership to continue before the pandemic occurs, and to really think about, what are the functions that they're performing, and then who can take over for them in the events that they're unavailable. So, the other things to keep in mind as you're kind of designing this order of succession is to make sure that the people that are going to be impacted by the change is actually aware of it before the incident occurs. So again, for example, I should know that Jen, that I'm actually Jen's alternate, so that if Jen is unavailable, I'm the one that needs to kind of go in and make sure that I start sending out the emails and updating the website. You also want to define, kind of what are the responsibilities that that person is going to take over? Are they going to take over just some of that person's responsibilities or all of it? So in my case, do I just take over sending out the emails and updating the website, or do I take over everything that Jen does? And then, of course, ensure that the person taking over these responsibilities understand all of the duties that they're taking on, and consider whether the things that they normally do are going to go undone, or if they're going to now be responsible for the equivalent of 2 positions. And then, of course, thinking about, do you now need to create an order of succession for the person that's going to be taking over for another staff person? Or whether you want to create a leadership order of succession plan for everybody within your leadership, every single critical staff member and every single critical volunteer. And of course, for the most critical positions, trying to make sure that you don't just have one person taking over for everything. So the delegation of authority is really defining who has the power to put somebody in charge of something that they're usually not in charge of. This can be done either independently or combined with an order of succession. And again, it's important to know that anybody that's impacted by a delegation of authority is aware that it exists and what it actually entails. So for example, at HSC, if our executive director is out of the office, who is in charge? So if I'm the next person in charge, do I have the ability, or do I know that I have the authority to put Jen in charge of X and another staff person in charge of Y? And so that's what a delegation of authority is that, I have the authority now to put somebody in charge of something that they might not have been in charge of before. Again, it's always helpful to make sure that staff are cross-trained, so that way they understand what kind of duties and responsibilities they are picking up. And also, if at all possible, to create standard operating procedures so that whoever steps into a particular essential function has everything that they need, such as any important steps they might need to take in a particular process, if they have all the documentation or any of the key contact information they need in order to be able to actually perform those duties or tasks easily once they step into that role. And again, it is always helpful to be able to have the staff to practice what these duties and what these roles or responsibilities might look like prior to an emergency situation. But of course, it is never too late to have them practice even now. So again, this template can be found in the toolkit. And I also want to note that we will be sharing at the end of this training information and more templates around actually creating a continuity of operations plan for your organization. HSC actually has a series of more in-depth webinars with templates for each of those webinars, so that you can step-by-step go through the process of actually creating a plan for your organization. So, when you're planning for resiliency, it's helpful to think through a little bit about what your staff might need, things to prepare for. So, and what your organization might need in order to better plan for an emergency. So, your organization might want to think about things like, staff shortages. So, is there a way that you can get temporary staff in place, or replacement staff if needed? Many organizations were doing up pay or hazard pay during this pandemic, things like overtime pay for your staff, just to kind of allow them to continue to work during this time. Things like additional workspaces or additional leave policies. Do you have work from home procedures in place? And what are some of the supplies and support services that individuals might need, either in the workplace or to work from home? So things such as PPE for people that are still working in service sites, or transportation support to get them to work. If you're working from home, what do people need to work from home? So just as a very just as an example, when HSC started working from home, we realized within a month's time that none of us had a printer or scanner at home. But we needed to have one in order to actually be able to sign some important documents, because we weren't doing everything digitally yet. And so that was just something that we hadn't thought of, hadn't prepared for, and had to get. So it's helpful to think through a little bit about, what are the various staff needs for either within the office or outside of the office, to be more prepared in the midst of an emergency or pandemic, to be able to continue to function. And then, of course, we've mentioned volunteers a couple of times. Volunteers are present a unique challenge during an emergency, because they typically use their free time or their time off to really help out with an organization. But in the event of a pandemic or an emergency, they might become unavailable because maybe their regular job has greater need of them, or because they just have other things that they need to take care of or handle, or they might just be unavailable for any other reason. And so if your organization relies heavily on volunteers, especially for critical functions, please consider checking in with them during the earlier stages, if at all possible, to communicate with them and figure out, do they need any assistance, and whether they're going to be available to continue helping your organization throughout, and of course, to continue checking in with them. And so then the next step is, thinking about the types of services that you're providing to your external community, so the community that you are serving. You may need to provide additional services, and I'm sure many of you have had to either shift the way you provide services, or change or add on the types of services that you're providing, in order to help those individuals maintain continuity within their lives during this pandemic. And so in order to do that, you will, of course, have to determine what you can actually provide and how you can actually provide it. So for example, if you're an organization that used to serve meals in a community setting, we've seen that that is just not possible anymore within a pandemic. So your organizations might have shifted to, takeaway meals or to home delivered meals, which can, of course, cause different challenges or present different challenges for your organization. And so, of course, with all of these things that we've spoken about, so many of them will result in additional costs to your organizations. Again, we've been living in this pandemic for 9 months more. Many of your organizations have seen additional costs and hopefully have figured out what some of these additional costs actually look like for your organization in order to provide things like, again, cleaning supplies, PPE, mental health support, overtime or up pay, things like tech support or other resources that your employees might need to work from home, whether it's laptops, phones, chairs, office supplies, etc. And also, of course, the additional costs of doing outreach to your communities, whether you're printing additional materials, whether you're doing robocalling, whether you are just, any type of outreach that you're, doing just to make sure that people understand what's going on with your organization, what kind of services that you're providing. Things like paying for or trying to get temporary staff, paying for additional leave for staff who might need to take more time off because they're sick, etc. So again, these are costs that can be happening either just once. So if you're just buying a thing one time, they can be things that are recurring monthly or weekly or even daily. And so trying to build in what some of these costs look like for your organization is very important. Obviously, we've also seen, though, that many agencies that have had government contracts, particularly with the city and state, have seen some of their funding actually cut or withheld. And so it is very important in order to try to account for some of these additional costs that your organization is incurring, that if at all possible, to speak with your contract manager to let them know and to talk to them about what kind of deliverables that your organization is providing, how that might have changed, as well as what your budget is, to see what things can be adjusted so that you can continue to sustain critical services. And of course, HSC understands that, again, some of this funding has been cut or withheld, and we are, of course, working very hard on our advocacy efforts to try to get those dollars back out again. So, one of the things that your contracts might actually ask or request or require of you is that you actually have a continuity of operations plan. And so just making sure that you are taking the time to, see what parts of it are missing, what components are still missing, so that you can either update it or add to it. And again, all of this work takes time. It takes staff time, it takes staff energy, and that all kind of adds up to more additional costs that your organization might not be expecting, but it is important and critical and very helpful in getting your organization able to continue to operate in the midst of an emergency. And so again, just to kind of let everybody know, we are recording this presentation. We will be happy to share the slides. We have actually created a series of trainings that were recorded earlier on in the year around creating a continuity of operations plan for your organization. And we also do have templates available. We will send all of that out at the end of this training. Jen, over to you.
Thanks, Jason. So yeah, just building on what Jason said, continuity of operations is a really continuous process and it just never stops. I think it's a very typical thing in organizations to put together a continuity of operations plan or a line of succession or whatever it may be, and then be like, we did it, great, and then kind of put that plan on a shelf and never revisit it or never onboard people with as part of that teaching them about the continuity plan. So at HSC, we revisit our COOP every year. We go over it as a staff, and it's also part of our onboarding process to teach people about the COOP and to discuss that plan so that they know if something were to happen before they got trained more in depth, that they knew what a COOP was and how they could go about accessing it if they needed to. For an example, if your emergency contact list was created in 2015, I'm sure by now there's new program staff, there's new leadership, there's new phone numbers and email addresses for folks. So making sure things like that are really updated regularly, and it's just an automatic process like you would have, in your bookkeeping or anything else that you do fairly automatically. So just keep on keeping on with it. So we have a few minutes and I want to make sure we open the floor for questions. If there's anything that came up now that you want to ask about, we'll also share our contact information so you can get a little bit more thinking done before you ask a question. So I'll let you start putting that in the chat. And while questions are coming in, I'm going to also move forward into our post-test poll. This is helpful for us and for the Department of Health and our funders to get a sense of where people are, finishing this presentation and what more information we might want to provide. So again, you have to scroll down, but while you're thinking of questions, if you could also just take a moment to put in your answers to this poll, would be great. Thank you. And since I know folks are going to have to start filtering out, and I want to make sure you have this, I'll just also keep filling out the poll, but I want to make sure you see our resources, which we will send out in an email, but this is if you want to look at it now. We have the first link is a lot of our disaster preparedness resources, including HS Alert, which I want to give a shout out to. It's a alert system, text, email, phone calling that's used whenever traditional communications are inaccessible. So it's only for human services organizations, and we use it. We haven't really needed to use it during COVID because everyone's internet access and phone services are available to them for the most part, but we want to make sure people during hurricanes and things like that, we can get information out through HS Alert. But that has all our disaster resources, and then our COVID-19 link has all the COVID specific resources housed there. So please browse those. We love your feedback again on what folks think would be helpful in the future. And then here's Jason and my information. Please feel free to send questions to us, thoughts. And then also, we again really want to make sure we're pushing information up to the Department of Health that can help them improve this toolkit. So as you're looking at it at your leisure, I encourage you to think about what you wish would be added or changed for a second version of the toolkit. And you could share that with us. We work directly with the Department of Health and would be very much interested in getting that information to them. So again, this is our chance to have the toolkit fit the needs of the sector as much as possible. So please use this information as you find it helpful, and we will make sure to send out everything we shared today in an email to everyone after the fact. So thank you all so much. We really appreciate you taking the time. I know everyone's so busy right now to join us. And again, we hope you'll reach out to us with questions and feedback.
Thank you. And if you haven't had the chance to do so, please answer the poll or respond to the poll if at all possible. We greatly appreciate your feedback. Okay, everybody. So thank you all again for joining us. Stay safe and have a good rest of the day.
Happy holidays. Have a good day.